At Rody Chiropractic, we are family. I think because it started with my dad and my uncle, there was already that family feel. And I worked there since I was 13. My cousin worked there since she was 13. My sisters worked there. And so there was a lot of family. And so anybody that started working at our office sort of became family. They were adopted into the circle. And so now it's my dad and I and 3 other chiropractors. And we have a beautiful picture on our fireplace that patients are like, how about you and your brothers? Like, how does that work? And actually, they're not brothers. They're other, chiropractors that have come to us, but they are like brothers to me. And we're a big family. And so the office is set up in a beautiful, like, mountain lodge feel, that feels very inviting. Dad didn't want a sterile white chiropractic office that you're like, you feel awkward just being there. This is inviting. This is like coming home. And so that's a big part for us, is we want to know people's names. We want to, be a part of their family and be trusted into that. And so you're not just a number. And I think that goes a long way when people feel welcomed. And by this point, 40 years or more into chiropractic for 2 generations, we've seen grandparents and parents and kids and have been able to be a part of their lives and change their lives in big ways. So, every person alive has an atlas, and so from babies up to our special old people, everybody needs some help with that. And it's such a movable joint that they get out in weird ways. And so having a tool that we can assess and correct those misalignments and let that body work the way that it's been designed to is pretty phenomenal. And you don't have to hurt. Most patients, after they get adjusted, are like, did you actually do anything? Because you don't feel it. But they feel the difference after. They feel the warmth of the face. They feel that kind of whoosh feel, that all that fluid around the spine now is opened back up. But they feel it relaxed too. They're like, now it doesn't hurt anymore. It's pretty amazing. It's interesting because a lot of people don't think that kids need to be adjusted. Their spine's so flexible and they move fine, they seem fine, but going through the birth canal or even a C-section, you can get twisted and get pulled on. The moms, they're desperate. They are tired themselves and their kiddos are not sleeping well or eating well, and they are looking for help. We have a little tool that's just nice and gentle, and you just gently tap, tap and move it back in place, and the kiddo just usually relaxes. Like, you just see them almost take a breath. It's pretty amazing. And just that tension that they were holding, it just melts. And then the mom says usually they had a big poop on their way home and they slept the best night of their night. And so it's pretty special. One of my hardest patients that really was looking for some care out of desperation was a patient that had pretty severe migraines and had had years of just injuries over her lifetime. And she had tried chiropractic in various ways, but I was willing to work with her. I was willing to work outside of the box and not just try to fit her in my box. And so that's a big part with patients. You have to take them individually and figure them out when they don't work, and that certain typical pattern, how can I look at it differently? Just like we're learning in a seminar right now is the atypicals, the anomalies, and helping their situation. So yeah, with her Atlas Orthogonal, she can hold her adjustment and feel like quality of life come back. She can function, she can go to work. When her neck goes out, she can't go to work, she can't drive. She gets very dizzy and struggles quite a bit. And so now her husband's a patient, her daughter's a patient, several of her sisters are patients, because when they see the effect on one person and they can apply it into their lives too, and like, hey, I have problems, maybe it can help me too,